This podcast is proudly sponsored by Joro Protein, a Rhode Island plant-based protein supplement company designed for athletes and adventurers. They deliver 25 grams of protein, 5 grams of BCAAs, and 18 essential vitamins and minerals. It's non-GMO, it's gluten-free, it's allergen-free, no artificial flavors, no added sugar or stevia, and it has no additional gums, thickeners, or fillers. Right now, you can get 30% off on this podcast with the code Joro Rhody Strength 2022, and you can find them at joroprotein.com.
This podcast is brought to you by Phase CBD. That's P-H-A-Z-E. They are a local Rhode Island company who makes and manufactures a wide-ranging variety of CBD products that are formulated specifically for athletes. It doesn't matter if you're a CrossFitter, a strongman, bodybuilder, or powerlifter. These products are for you. These products range from tinctures to seltzers to even roll-on applicants. By supporting this business, you're supporting a local Rhode Island business and you're supporting this podcast directly. Please check them out at phasesports.com.
I listened to you on the Savan podcast, so I know you're not going to be obviously as hard hitting as those questions. So I'm sure.
Oh, he was well behaved. He was
actually
very well behaved. I was like, he's going to get me in trouble, I'm sure, but no,
you did awesome.
He kept him. I mean, I did an interview with him like 5-6 years ago when we first met, so I was expecting sort of like some of his craziness from back then, but it wasn't nearly as controversial as it could have been. So I just gotta stay out of the.
Well, we have no intention of being controversial.
Okay, I didn't get that vibe, so
No.
Yeah.
Cool. All right, so I guess we can start it off. Unless you have any questions beforehand.
No.
Cool. All right, let's do it. All right, what's going on, guys? Dr. Matt here, host of the Rhody Strength Podcast. We have another special guest on today, Dr. Amy West, MD, ETM FAAPMR. You're going to have to explain those initials to me.
Yes, sure. Not a problem.
And we got co-host Jeff Arnold. What's going on, guys?
Hey.
Hello. Yeah, I'll explain that. So MD is a medical doctor. EDM is a master's of education. And then FAAPMR, which is basically our society for PM&R physicians. I'm technically a fellow of that group, so I don't often put that one on there too, but yeah.
I don't know where I found those. I think I looked you up on maybe like either Hofstra or somewhere else that you work, and I just copy and pasted them. But I'm I'll have to ask that question. Yeah. What's the PMR group?
So physical medicine rehabilitation, that's my specialty. So the AAPMR is the Association for Academic PM&R Physicians. So it's our big, it's like, you know how the AMA is American Medical Association, that's for like people in medicine, and then AAPMR is like the PM&R version of that.
Gotcha. Very cool. And I'm gonna pick right up where I think I just listened to your Savan podcast, so it's fresh in my mind, like about a week ago. And cool. He was talking about, Amy, you're a real doctor. So I'm just gonna come out right and say I'm a physical therapist. I'm not MD. I play a doctor. I'm a pretend doctor in some ways. So
okay. Yeah.
But you're the real deal. So I just want to give you a short bio. So just kind of, and we'll obviously dive into things as we get into the podcast. But
sure.
So you're a sports med doctor, and if I screw up, correct me, please.
Okay. Yep.
You're a sports med doctor at Northwell Health, team physician at Hofstra University. You have your CrossFit level 1. You're part of the CrossFit health team, and which I watched that seminar with you, Kelly Starrett, Sean Rocket, like all of them. I thought that came out awesome. And
cool.
You're also part of the CrossFit Games medical team, which I want to talk about too, obviously, because you were just there.
Yeah.
It looked awesome.
It's always a lot of fun. It's always like the craziest week. It's a lot of fun, but like we work all day, and then there's like parties all night. So come back exhausted from a week for sure.
Yeah, definitely getting FOMO with the pictures you were with Medeiros and some of the other top athletes. I'm like, that's badass. That's awesome.
Yeah.
So we'd like to kick it off with rapid fire questions. Now, a lot of times these are just for my own entertainment. So I always apologize to the audience if they're boring, but I get entertainment out of them. So my first question is favorite coffee shop. Now this could be somewhere like you're in New York, I'm guessing. So maybe somewhere
in New York. Yeah.
Yeah. So where do you like to get coffee?
There's a place over here called Sweet Leaf, which I like because in the morning, well, during the day, it's a coffee shop, and at night it turns into a bar.
Awesome.
So that's a nice kind of combination. But I'm a big coffee shop fan in general. So when I travel, I look for three things. One is a CrossFit gym, two is a coffee shop, and three is a bookstore. And if you can find a spot where all three of those things are, it's likely a cool place to be. So
Oh man, I think you would like Rhode Island. You might have to come visit
Oh yeah,
us.
okay. I don't think I've ever been to Rhode Island, so okay.
There's a lot of all three of those.
See, and it's a cool place.
That's
so
I never
it's
thought
like,
about that. That's
like,
there's a couple places I know that are all three of those in one.
oh really?
Yeah.
Oh well,
Yeah.
that sounds awesome. That sounds awesome.
Yeah.
Yeah. So yeah. So just think, it's like where cool people will be there. So like
Yeah.
it attracts cool people. I like to consider myself one of those people. So
Right on.
Yeah.
Totally. And just quick follow-up question on that. How do you take your coffee?
Black.
That's the most common answer on the
Savage.
show.
Yeah.
Savage.
Black. I do black. Or I do enjoy occasional almond milk latte, but it has to be unsweetened, which is really hard to find places that don't that have unsweetened almond milk. So it's like rare.
Yeah, it's maybe at the grocery store. Tough at a coffee shop though.
Yeah.
Next one, similar question. If you have a favorite go-to breakfast spot or just something maybe that you make on your own, like your kind of typical, like what you eat in the morning.
So what I normally eat in the morning is a combination of oatmeal, protein powder, and egg whites. I mix that up and microwave it.
Solid.
Yeah, it's like and maybe add a little bit of almond butter in there. That's what I like to eat. But what I enjoy, I don't know if they still make it, but Panera had a sandwich where it's like a egg and cheese sandwich, and you can get this there's like this maple sauce on it, which is like dope. It was really good. I don't know if they still make that, but that added like sweetness was like beautiful. So that was like usually like a weekend treat for me.
I actually have a coffee shop for you up in Maine then that they literally have a maple bacon breakfast sandwich that's
in
absolute
Maine?
Fire. Yeah.
Whereabouts
if you ever
in Maine?
venture up to Portland, it's
I
right
used to
in
live
Portland.
there. I lived there for a year.
Oh, did you do your residency at Maine Med?
I did my sports medicine fellowship there.
Oh, okay, cool.
Yeah.
That's awesome.
So, what place?
I think it opened like literally in the last year or two. It's oh my gosh, I can't think of the name of it. I was literally there Monday morning.
Oh wow.
Oh, it's called Roots Cafe. Sorry.
Roots. Okay, yeah, I don't think I've ever been there. Yeah, it must be kind of new.
I've
been there in a few years. Okay.
Oh, okay.
I'll
It's
add
in
it to my
Westbrook
list.
though, so it's not in Portland.
Oh, it's a little bit outside. Okay. All right. I'll add it to the list.
Next question, we got favorite Instagram accounts, and the way I describe this is maybe it's someone you follow for inspiration, someone who makes you laugh, or maybe something that's like educational.
There's kind of a few ways to go with that question. So I mean, as far as like educational stuff, I enjoy Kelly Starrett's stuff. He's just like he's a really cool person, and he's taught me a lot. So videos just has cool things on there. As far as like just like stupid stuff, there's like these accounts that show like vintage things from like the 90s, and it's like, do you remember this? Do you remember like this toy or like this TV show or whatever? It's like, oh my god, yeah, I remember I had that. I think it's called I Had That. It's called like, oh shit, I had that or something like that. But so that's just like silly stuff that I enjoy. So then there's another one that's called another random thing. It's called like Freezing Cold Takes, and it's like all these like sports takes that were dead wrong. It's like this Michael Jordan guy isn't going to be that good, and like like some
that's amazing
newspaper article from like the 80s that some guy wrote, and it's like wrong. So stuff like that. Just silly things like that.
Okay, I might need you to send me that page because that just sounds like a great way to waste time.
It's total waste of time, 1000%. Plus I have a mini Dalmatian dog, and I love Dalmatians, so there's always like these cute dog videos that I can get lost in for a while.
That's great.
Can't argue with that.
Next question we have is favorite podcast, and kind of same explanation. Something maybe you just like for fun, or something educational, or whatever you're listening to right now.
Yeah.
I mean, other than us.
Right, obviously. I enjoy Sevon's stuff. You know, he and I go way back, so he just is entertaining. So I've been listening to a lot of his stuff lately, and so that's kind of gotten my attention at the moment.
He interviews
but-
everyone. I was looking
yeah.
through he's like, there's all the people he's going through. I'm like, wow, he doesn't miss anybody.
Yeah. And then I'm gonna plug my own podcast called Docs in the Box. My friend and I, Matt Cowling, who's another PM&R physician, it's like a little thing that we just have been doing for years. We interview like people in and around CrossFit in the medical space, kind of who are doing things in both.
That's so cool.
Yeah. So yeah, it's fun. It's just like a little hobby, but we've had some pretty cool guests on there. So Docs in the Box is what it's called. So.
Okay, right on.
You're a podcast vet. You've been on a ton. You have your own. You know what you're doing.
I guess. I don't know. It comes in waves, so
Sure.
I'm always happy to talk about myself. That's
easy.
Yeah.
Next question is very related. Favorite books or anything you read recently, or maybe something on Audible or something you're looking forward to read?
Wow. Well, I'll just talk about the most recent thing I read. Is that so back when I did Sevon's podcast when he worked for CrossFit, I was in like the CrossFit HQ building, and they had like all this stuff there, and he was like, do you want any of this? And he just like gave me a bunch of books. And one of the things he gave me was I think it was like Toomey's like autobiography. So I just found it the other day. I was like, let me look at that. Given that she keeps winning. So I just read that recently. So that was interesting. It's always interesting to hear what motivates people who are super successful like that. So that's just like the last thing that comes to mind.
That's great. I feel like that needs to be a documentary.
Yeah, I'm curious how similar. I'm curious if there are like any similarities in like the psychology between like her and like a Michael Jordan type figure. I mean, obviously, like two different sports, but like a champion is a champion at the end of the day.
Yeah, she's like super focused, and it's like one of those things. Like the common theme in her book was like, I started this thing, and then I won everything, and then I did this other thing, and then I won all the things there, and it's like, oh, okay. So, she's just one of those people that just like does not accept anything else other than that. So,
totally,
it's unbelievable.
Yeah, but it's also like, and she talks about like her relationship with Shane and all that, and that's kind of also an interesting part of the book, that kind of dynamic. So.
Yeah, I've always been curious about that dynamic.
Yeah.
It's got to be kind of fascinating and also very stressful at times.
I would imagine, yeah. But the other thing another book that I always tell people about, it's totally ridiculous, but it's like, you want to get inside the head of a crazy person, is, she was the goalie for the American women's soccer team, Hope Solo.
Oh, yeah.
She wrote an autobiography, she wrote an autobiography, like, I don't know, almost 10 years ago. And she's like a little bit off, but it's just like super entertaining because the way she sees the world is really interesting. So I just tell people, read that book because it's crazy. So I'm not particularly like a fan of hers or anything, but like it's a good read. If you're looking for something to read that's like kind of mindless, pick it up.
It's an autobiography? She wrote it herself?
Yeah, she wrote it herself.
Gotcha, okay.
And it's like a lot of events that happened.
Fascinating.
Yeah, a lot of events that she like talks about, and it's like you saw it on the news, and like when the way she like interpreted how it happened was like definitely not what happened, but it's like all right, I'm going with it, like cool.
Right. This is my reality. Like, welcome.
Crazy. All right, yeah, so it's entertaining for sure. Yeah,
that's fascinating.
So next question we got, and when we can talk about the CrossFit Games could be your answer to this, but any travel plans recently that you were really excited about, or both, like anything coming up that you're excited about?
I was just in the games. That's always it's always a good time. Because you're in this town where like CrossFit just takes it over. It's like you go there and you're like in an alternate universe where everyone CrossFits and everyone just gets it, which is really cool for people who are into that. And then I'm working there, so I was like working, I was speaking, I had meetings, there's parties. It's just crazy. it's a fun time. It's a bit of a reunion. I get to see all like people that I don't see very often, and then it's like a whirlwind. I'm like up from like 5 a.m. to like midnight every day, and then I come home and everyone's like, how was your vacation? And I was like, I am tired. Like I am very tired, but it's fun. It was a good time.
That's great. Yeah, it's tough when you're, I mean, it's obviously it's fun, but like you almost like the typical saying, like, I need a vacation from my vacation. I need to rest.
Yeah.
Do you wear a
and
whoop
you're
at
like,
all?
I do. I have one on right now.
What,
Yeah.
wait, how was your
Yeah.
strain that week?
It was like there was one day
recovery.
it was a bit altered. And also like one day like I logged events on it, and it was like, and I didn't realize they have like medical coverage. It's not called like medical something as a category. So like I was able to log that as like an activity, which was actually more than the workout that I did that morning, which was then, and then I also had like a stage performance. So I had like, I use these categories I don't even use very often, but it was kind of cool to like log those in the app.
That is
It's
funny.
pretty
Like,
interesting.
like sometimes, I don't know if you used to get the same thing, Jeff, but like sometimes when you're coaching a class, you get like that stage performance one come up. I'm like, that's kind of accurate for what just happened in the past hour.
Oh, yeah, it's called medical operations. Medical operations. That's the title of that category.
Cool.
I used to constantly that like as a heads up on my Apple Watch. Are you working out right now as a coaching your class?
Yeah.
Yeah.
Your audio is coming out just in and out just a tiny bit right now, Jeff. I don't know if it's temporary, but just a heads up.
Quick.
All right, so we'll move on to kind of a little more about your biography, Amy. So first question, and I'm sure you've talked about this 100 times, so we don't have to be a dead horse. But how did you get into CrossFit?
So I went to med school. So I went to med school at Harvard, and down the street from it was CrossFit Fenway, which is now no longer a thing. It's now Invictus Boston Fenway, whatever. Yeah. But I used to kind of pass the building all the time, and I would see people outside doing all kinds of crazy things, and at least what I thought was crazy at the time. And then one day I just was like, okay, I want to try that. I finally had like a little bit of time to like do stuff, and I was like, all right, I want to try this. And then I was hooked pretty much from the beginning. I had spent my whole life playing like team sports, and you know, you hit a certain age and then like you just start like all your sporting activity becomes like running. I tried to get into running for a while, and I was like, meh. And I'm going to like a regular gym, which was like also not fun. Even though I like working out, I just don't like sitting around on machines, and like it was stupid. So when I started doing CrossFit, I was like, oh wow, this is like fun. I get to learn new things as an adult person. I get to like meet people and have people cheer for me, you know. So then I was like, that's it, I'm in. And then I found my specialty kind of at the same time, and they're sort of aligned as far as like goals and ideas of like around function. So it seemed like a pretty natural fit for me.
Is that where you also met Bern?
Yes, actually. Yeah. Yes, it was.
So now the connection makes sense.
Yeah, he was working crosstown at Back Bay, and then they merged. So, but yes, I've known him for a very long time. Yeah.
Shout out Bern Prince and the IBI, Invictus Boston Invitational.
Oh boy.
I actually wonder if
I don't know if we need to talk about that. That was not my best day for sure.
No? Oh my gosh, you did amazing.
I tore my ab about 2 weeks before that.
Ooh.
So it was really hard to do anything. So I couldn't, like, the first workout was all like gymnastics. I couldn't kip. I couldn't swing from a bar. So that kind of hindered it. And then the whole handstand walking thing's hard when you can't hold your midline. So I was like, oof, this is not. So I'm like, next year, guys. Next year.
Next year is the year.
Did you have fun though?
It was fun. Yeah. I mean, I hadn't been to Boston in a few years. So, you know, like, so I hadn't been to Boston in a few years. And I hadn't seen a lot of those people in a long time. So that was fun. I was like, okay, next time
awesome.
I have to not suck, but you know, look, next year, we'll see next year how it goes.
How did you have that injury? How'd that happen?
I was practicing like butterfly chest to bars and like other things where I was just like swinging a lot, I guess.
Sure.
and it like hurt a little bit. And then one day I just felt it like rip, and I was like, oh. And then for like weeks after that, I couldn't, like, you'd be surprised how many things you can't do when your ab is torn. Like I was trying to do burpees once and I couldn't do it. Or like, even like holding myself in like a plank position was like brutal. So yeah. So I thought about like, oh, maybe I can't do this. And it was like just healed up enough that I could like do it without being in a lot of pain, but it was like not working that well.
Yeah. That's
so,
it's a tough decision, especially competition. You're like, I am kind of healthy enough to just kind of skate by, so I guess I won't drop out, which that's a tough decision sometimes.
So I was like, whatever, I've already got the plane booked, I'm like, oh, let's do it.
Cool. So I know you already mentioned you went to Harvard Med School, and then you did your residency at Spaulding, which is, I've always heard of it as like, oh, Spaulding, that's an unbelievable hospital. And I just did a quick search before the podcast, and this is from Wikipedia, but so I'm just gonna read it word for word. So Spaulding Rehab Hospital is the only hospital in New England to be continuously ranked by the U.S. News and World Report in the best hospital survey since 1995. In 2018, it was ranked number 2. So it's always top of the list. Not maybe number 1, but since 1995, it's always up there. So
for rehabilitation hospitals, it's kind of the place to be.
You always hear that, like, if someone's really screwed up, they're like, okay, I have to make sure I go to Spaulding. Like, I need the best.
It's just, when I was there, we had all the victims from the Boston Marathon bombing.
Sure.
So that's how, when I was a student there, so that's kind of how I got kind of hooked on the place and on the field, because it was kind of if you're going to be working in a hospital, you want to be working in a rehab hospital, because that's when people are kind of getting better, and they're sort of, it's a lot more celebrating that goes on in a rehab hospital. Like, people are like learning how to do things again, people are getting their lives back. It's like all positive, people don't die there, people aren't getting real sick there. It's like they're over like the initial trauma of whatever it is that's gotten them in this position, and now it's like all about just like making gains. So I always called Spaulding, it's like a resort. I mean, it's like, for people, if you're going to be sick and you're going to be in the hospital, you want to be there. It's a nice place to be.
Yeah, that's awesome. I would say like it's probably a lot different from like, obviously, like ER, where it's just like get people in and out as quickly as possible, or basically like if it's trauma, like get people stabilized as quickly as possible, versus like you're saying, like rehab hospital, like you can actually watch them get better.
And people are there for usually longer, like long stays, and there's, and like part of the reason they're there is kind of like, I don't say work out, it's like they have PT, OT, speech therapy, recreational therapy, adaptive sports, like it's like you're there to be active and like learn how to do stuff again, which is nice.
That's cool.
Sure. Do you have any specific experiences of like just somebody that you got to be there start to finish to when they left, that you just saw like the huge change and something that just really struck you?
I mean, it happened quite a bit, which was what was cool. But you'd see people. I mean, I'll talk about like certainly the people from the Boston Marathon bombing, for example. Like, people came in, a lot of them had lost limbs. Many of them had some kind of traumatic brain injury as a result of the blast as well, which often goes unnoted. Like, people didn't realize that. I mean, sometimes on rounds, like, we were pulling out like shrapnel that was still coming out of their skin, and it was all evidence, so we'd have to save it and like give it to the police. So some pretty sick people, some pretty people who came in after, obviously this is a very devastating public thing that had happened to them, and then we're leaving with new prosthetic limbs, like running, and like really they'd sort of kind of like turned the corner and then became like advocates and stuff. So it was a really nice kind of transition to see that, and a lot of like people that were there like ran the Boston Marathon the next year, or like a couple years after that, with their new limbs and stuff like that. So it was kind of like a weird, like an interesting kind of fun, like as fun as like that kind of situation is going to be.
Sure.
Wow, that's or like inspirational in some ways, or motivational for people looking on. Like, wow, you're able to overcome such a terrible
Yeah.
accident and make it back to
Yeah,
the
I mean,
marathon.
yeah, some of the people had, they had limb loss, traumatic brain injuries, like hearing loss, and burns, like really bad burns too. And it was rehabbing all those injuries at once. So, but yeah,
Totally.
it was a pretty interesting time to be there.
There's one thing we all, at least I think for Matt and I, we can say is we take what we have day to day for granted sometimes, and you see and hear something like that, and it just kind of is humbling, to say the least.
Yeah, I mean, I've seen in those kind of hospitals. So we'd someone who was riding a mountain bike and just like flew off the front of it, ends up with like a high spinal cord injury, like paralyzed from the neck down, and you're just like, Jesus, like stuff like that, where you say like, you got to say, oh, I'm pretty lucky, and people who making the best of that situation, like people who really kind of trying to make the best of it and like learn how to live their lives again, and that in and of itself is like commendable.
Totally.
Absolutely.
Yeah. I'm going to switch gears just slightly, just to get on kind of because I know that was where you did your residency, right, at Spaulding.
Yeah.
But now you're more focused into so I have it the non-operative sports medicine.
Yeah.
Okay.
So I did a sports medicine fellowship after that, and that's when I was in Maine for a year. And now I'm back in New York.
And I have just some of the things written down that you specialize in. Musculoskeletal ultrasound, which I had a question about that. Is that more diagnostic?
It's both. So diagnostic, and then also for procedure purposes. Like I do a lot of ultrasound guided procedures with a needle. So.
Gotcha. Like injections or like what type of stuff?
Yeah. Injections, like tenotomies, neurohydro dissections, kind of that thing.
Tenotomy. So that's when can you explain that one?
So like if you have like a tendonitis, for example, sometimes you can kind of we take like a very fine needle and you kind of I guess you'd say like poke the area of tendonitis to induce like an inflammatory response, which is a healing response. And that's like you kind of use a needle to kind of poke at it, for lack of a better way of putting it.
Okay.
Yeah. Okay, so like dry needle, really cool. But directly into the tendon.
Kind of, yeah, and you can do it with different kinds of instances, and there's like PRP and whatever. So yeah, there's different things you can do with it.
Sure. That's pretty interesting.
Can you explain the PRP a little bit too? Because I know that's really popular. I have people ask me about that pretty frequently, and I just basically send them out and be like, hey, we have a doc in the area pretty similar. You might know her name, Dr. Moriarty. She's also a CrossFit.
Yeah, I know her. Yeah. Charlotte. Yep.
Yeah,
I know
so
her.
she
I know
send people to we're getting so we get people and I'm like, all right, just send them off, like they'll give you more information. But can you explain that a little bit?
Yeah, I mean, so the kind of most basic kind of level is, so what PRP is we take a person's blood, we spin it down, put it in the centrifuge, and we get kind of the platelet rich part of it, which has like a lot of the healing factors of your blood. And then we take that part of the blood and inject it into areas where it can be used in areas of tendonitis, it can be used in areas of arthritis. Those are kind of the two most common things. And it works fairly well. There's a whole, it can kind of get pretty kind of in the weeds as far as like the concentrations that are used and the conditions it's used for and how effective it is. But if it's used in the right situation, which is for certain kinds of tendonitis, kind of mild to moderate arthritis, it can work really well, or at least as effective as a steroid without having any of the kind of negative effects of a steroid. So
it's interesting.
So it's something that the issue is that most insurances don't cover it. So it's not a pocket cost, and so a lot of people just like forget it. But they're doing a lot of research now to figure out kind of like the best kind of way to process the blood, if you will, so that it's most effective, and using it in other kinds of conditions. But if used in the right person, it works well. There are people out there who will like just stick it in anybody. They'll sort of like, they'll they'll sign someone up for like 5 injections and charge them $1,000 an injection and inject it into someone who has like bone on bone arthritis, and it's like it's not going to work, and you're just selling it to somebody just to
You're
sell
just
it,
taking their money.
So right. So I mean, there are people out there who will do that. So it works really well if in the right population, but there are people who kind of scams.
Interesting.
Yeah,
that's really good to know. And I know you mentioned, so I know a little bit about this too, but obviously cortisone shots are super and they're covered by insurance typically, and they're super popular. But some of the negative side effects, like I know, and you can obviously talk more about this, but what are some of the negative side effects for cortisone?
Well, the main thing is that over time it can cause further degradation of your cartilage. So someone who's like in a younger person, I almost never use it because you don't want to, you're just going to further degrade the cartilage over time. Also can weaken tendons. I mean, there's always a risk if you use it around a tendon that you can rupture it. So yeah, in younger people, I tend to stay away from it unless it's like a one-time thing or someone has something very specific they're trying to do. But in older people who's, kind of, that they're kind of trying to, either they can't have surgery or they trying to avoid surgery for whatever reason, I'm a little more liberal with it. But yeah, so in general, it's not something you want to use a lot.
Gotcha.
There's a physician I'm ready to exchange words with from a few years ago now.
Yeah. I mean, it's something you can do once or twice. In a younger person, you do once, maybe a year if you have to for whatever reason, but you don't want to get into the habit of doing that over and over again unless there's really no other option.
Sure. I mean, I only got one cortisone shot in my shoulder once, so I'm not too worried about it, but just the fact that the physician was so happy about it.
Yeah, so it, sometimes it has to be done, but
I have quite a few more questions on like kind of similar treatments. I hope that's all right. I hope I'm not gonna like bore you guys.
Hope I can answer it. I hope I can answer it for you.
Well, also I do want to take a break real quick, and then we'll jump back on if that's all right.
Okay, yeah.
All right, and we are back. So a follow-up question along those lines. I think you might know where I'm going with this, but stem cells. Do you know I know this is kind of like this thing that everybody's, if you listen to any Joe Rogan episode, is bound to come up, but it's kind of this thing everybody's talking about now. I don't know if you have any information on those. I'm sure you get asked that all the time.
Everybody wants to go to Central America and get stem cell treatments.
So, I mean, I can talk about it in sort of kind of sweeping terms.
Sure.
So part of it is when people say stem cells, and when they talk about it in this country, there are regulations as to how cells can be manipulated outside the body. So what people are calling like stem cells, if you're getting any of those treatments in this country, it kind of technically isn't really stem cell because of the way the cells have to be harvested and manipulated. So that's kind of the first thing.
So if you're getting cells in the US, they're not probably real stem cells or not true stem cells.
No. So what they do, there's two things they through your cells. And again, like the data surrounding those injections, again, there's a lot of kind of debate as to concentrations that are used and which is the best way to harvest it, whether it's in the bone marrow, the fat cells, how to process it. The studies as far as treating things with either bone marrow aspirate concentrate, it's called BMAC, or the fat cell versions it's a company called Lipogems. The data is actually fairly promising, again, like in the right patient population. So a lot of like chronic tendinosis problems, arthritis that's sort of mild to moderate, actually has promising results. Again, it's not something that's covered by insurance, so it's a bit of a pricey thing. So that's why I don't, in my practice, who I work for right now, we don't do it just because it's the setup and the whatever. We don't do it currently, but I think they're trying to move towards that. But anyway, there's some companies that do a fair amount of it, do their own research on it, and have fairly good results. So, but people are going to Central America and in Europe and stuff because the way that they can process the cells there, you get a more true quote unquote stem cell and it's believed to be more effective. I mean, there's companies called like Regenix that does a ton of that. Jason Markle, who's a physician, who's one of their head physicians, I actually had him on my podcast a while ago. He kind of can talk way more in depth about it, but he's someone who does a lot of that work here, and then they have a clinic in the Caribbean somewhere where they kind of do more kind of those extensive things, and that's where you feel like you see like a lot of these like, you know, people going to get extra work for like things like rotator cuff tears, for example, and things like that. Again, in the right population, with the right rehab process, it works well. But again, like people calling things stem cells and sticking it in like these full thickness rotator cuff tears that are not going to actually heal, you know, then again, then it becomes like sort of a money laundering scheme. And then you'll have people pointing at it being like, you know, everyone who does that stuff is full of crap. And it's like, well, no, it's just, you have to, it's very specific who it works for and who it doesn't.
Sure. Just like anything.
Yeah, that's
Right.
That's awesome. So because I was on the fence of like, is this actually legit or not? So it sounds like there is some use to it. Like you said, when done in the right population, when done properly.
Right.
That's cool. That's exciting.
Yeah.
Now,
and again,
I would even just say like, you know, actually doing the right rehab, and let's look at our population, our demographic CrossFitters, probably not going to end up being great candidates in that regard.
Yeah. I mean, sort of yes and no. It's like, you have people who are at least who want to be active and who will like actively try to do things for themselves, I would think. So that in that case it's good, but then you don't, you know, people kind of like smashing their shoulders after getting a stem cell injection is not going to be the best idea. So
cool. All right, I have more like geek out questions, so I'm sorry, Jeff.
Okay.
Maybe
No.
me too. Hyaluronic acid. I don't know if you guys use that much. I mean, I've had people use it before. Effectiveness, like when is it used for?
Yeah, I mean, I use that a ton for arthritis. Essentially, it's like gel that we inject into the knee. So what's good about it, it's pretty inert. There's no really like negative side effects of it either, other than it just might not work. There's sort of a theoretical risk of like an allergic reaction, but I've never actually seen anyone have that. But yeah, so it's good for like mild to moderate arthritis. Some people you inject that and it's like they're good. I don't see them for a year. Other people you inject it and it's like 3 weeks later, like my knees hurt again. So it's like, it's all over the place. And when you have people who come in with like this severe bone on bone arthritis, it doesn't do very much. But in the right population, or in a younger person who has arthritis from, like say you had a big knee injury and like a big knee surgery as a younger person, you're more likely to have arthritis develop at a younger age. So, you know, someone who comes in their 30s or 40s and has arthritis in their knee, it's something that's really good because it's not going to degrade the cartilage any further. So, you know, at least I see for most people are kind of like in this no man's land of like what can be done. So that actually works pretty well.
And I know this is obviously tough to say because we're talking theoretically, but let's say someone in that age group comes in, when are you choosing like hyaluronic acid versus like PRP for like, let's say like a knee injury?
Well, I always try the stuff that might be free first. So the HA and the hyaluronic acid injections potentially are covered by insurance, or if they're not, they're cheap. You know, they can be like $300 maybe, something like that. So you know, I would say like try that first, see if it works, and if it not, then we can always go down the road of, you know, PRP, which is usually about $1,000.
Gotcha. Do you see that becoming covered by insurance anytime soon? I mean, I feel like it's been around for a while.
I had heard that there was a health system, and I'm going to say it's Mayo Clinic, but I could be wrong, that had actually, their insurance had started approving it. And that's like a game changer because then it becomes a lot more, it's just more used. So then there's more data about it, but then just it becomes a treatment option that actually people can do. So I'm not sure if that happened or what's going on with that, but I mean, potentially I'm hoping that because it's also in the grand scheme of things, not that much money compared to what these insurance companies do spend money on. So
true.
You know?
Very true.
Yeah.
So from a different perspective, and not to just jump in and drilling you with questions.
I know, I'm sorry.
I'm just going down the line. But like I guess from your standpoint in like terms of rehab medicine, what actually is exciting you right now, whether it's like specific to a joint or a treatment, like because obviously we're seeing athletes being able to come back from injuries at like wild rates compared to what they used to. I mean, like the return to normalcy from a traumatic injury. I mean, look at Brooke Wells, perfect example. I mean, she blew up her elbow last year and was back at the games this year, and actually was in the run for a podium spot. Like, it was nuts. So I mean, like, what in terms of like rehab medicine is, I guess, not only like exciting innovation to you, but like really kind of driving your intrigue or your focus at this point?
Well, I guess in the sports realm specifically, I mean, I think the world of orthobiologics, so all these things of like bone marrow, stem cell, fat, whatever, they're developing and looking into more things every day as far as different kinds of things that can be injected and how they can be injected, and that stuff's all really exciting as someone who's not a surgeon. So and then the whole world of musculoskeletal ultrasound is even since I started learning about it, which was maybe about 10 years ago. I mean, the machines are getting better, the things you can do are way cooler, like the kinds of procedures that are able to be done. Something like 10x, which is like an ultrasound guided, essentially a way to remove like small pieces of tendons which are torn. It's basically like a mini procedure. It's like a mini surgery that like things that a few years ago you have to have like a surgery for. Now you can kind of do in an office visit. Even like things like carpal tunnel releases, like even like small, like doing a carpal tunnel surgery, which now there's these very minimally invasive ways of doing it under ultrasound, so that's kind of cool. So things like that are really interesting to me as far as like in-office procedures that can be done. And then as far as like rehabilitation, there's stuff like BFR, so like blood flow restriction. Star's super into that.
I love that.
He gave me like BFR cuffs. Well, that's when I was at his house. He's like, "Here, take these home." And then also like things like shockwave treatment for tendonitis. I've seen have really good results with that. So there's like cool things that are popping up all the time.
Can you talk about the shockwave a little bit? Because I had a question on that too.
Yeah, I mean, yeah. So essentially,
that's something I don't really know much about at all. So it was really interesting.
I mean, essentially, what it is like a machine. So this is like a really strong vibration that kind of, if you take an area that has tendonitis, for example, it like essentially causes, I guess you would say, like micro damage to the area to bring in that inflammatory response, and break up scar tissue and things like that. So I worked a lot with it in people who were like runners who had like chronic like Achilles things or chronic like tendon issues, where like they would do a handful of treatments with that and actually see really good results. So again, it's like in the right population of people, it works really well.
That's cool.
What I've seen anyway. Yeah.
It's fascinating. So I mean, in terms of, because like obviously I can point to it from a coaching standpoint, like looking at the evolution of programming and kind of how the yearly training has developed in CrossFit and other sports in general. But like, is there anything from just like, I guess the day-to-day psychological approach to the medicine of rehab that has changed significantly over the last 5 years, that like the way you approach, rehabbing a torn ACL, from just like how you would kind of prescribe treatment? What's like the biggest thing that's changed with that? And I don't even know if I'm asking that right. I hope that I articulated my question correctly, but
I think I get it. I mean, I think I've seen happen over the past 5-6 years in rehab is there's been a bigger focus on function, and like functional movement patterns, as opposed to like isolated strength about a joint. And it's like, for example, for the ACL injuries, I mean, now there's like some pretty well verified kind of rehab protocols that involve a lot of kind of, you know, functional movement patterns, like before someone can, you know, finish the rehab, they have to be able to do X, Y, and Z. Whereas like that was kind of a novel concept when I like started residency, which was kind of weird. So, you know, looking at things like that are really interesting. And they're always improving technology as far as like the actual surgery itself, which is a little bit beyond what I know about. But then the rehab process itself was really looking at that functional idea, which is like somewhat new in the field, which is weird.
That is interesting.
Yeah. And then the whole area of prevention. Yeah.
So would you say like CrossFit and like functional fitness has had an effect on that, with like the evolution of people moving more into the CrossFit space, or do you think they're just completely unrelated?
I'll say this. So I had heard a statistic that was saying that, you know, what happens in the medical literature is roughly about 8 years behind what's happening. Like before it's proven in literature, it's been happening for 8 years, you know, so.
Sure.
And I've seen that happen with CrossFit. So the word CrossFit is still somewhat of a dirty word in the medical space, but you talk about functional movement, and people are like, wow, what a concept. You know, and it's like, it's really kind of interesting to see like CrossFit has, you know, I was sort of like started in rehab when CrossFit sort of started to really kind of take off. So we're talking like maybe 2012, 2013.
Sure.
And CrossFit was like, no, it was bad. Don't do that. There's this very anti-movement, and there's a lot of reasons for that, which are not sound. But beyond that, though, there's but they started like great. You familiar with Greg Cook, who does the functional movement screen?
Yeah,
the FMS screen. So he basically invented this kind of. There's a few of them now, but like it was like a seven movements screen that, you know, one of them's like a lunge, one of them's a squat, one of them's a overhead, whatever. And you know, if someone, you could basically give someone a score on that and predict their injury risk or their, you know, rehab success or whatever. And I remember back in 2000 and I want to say 12 or 13, he spoke at our PM&R conference. He was like one of the main speakers, and people's minds like just exploded with this, oh my God, like what a concept. Like you can look at functional movement patterns and predict injury rates and blah, blah, blah. And I was like sitting there being like, as a CrossFitter, I was like, this is what we do every day, all the time, you know? And like, it's things like that where like you say, you know, the functional movement stuff has kind of come in and change things, but sort of indirectly. It's like, it's CrossFit, but people won't call it that. Or you can say high intensity functional movement. People are like, yeah, that's what a cool, and there's tons of papers on that. But you call it CrossFit and it's bad, you know, and it's like, you're all talking about the same thing. So it's been interesting to see that kind of from both perspectives.
To kind of follow up with that, we don't have to get into this because you talked about it pretty in detail about this in the Savant podcast. So if people are interested, they can go listen to that. But I know the issue with the NSCA kind of gave CrossFit that black eye early on, and they were able to reverse those findings. But I guess my question is, how can we, because like you said, people still associate that word with like, oh, it's dangerous. Like, and I know you just did a talk on this recently. How can we change that? How can we continue to make CrossFit seem like, okay, this is actually something that's not only good, but it's going to be healthy for you?
Yeah, I mean, I guess it depends who you're talking to, but like, I it's my favorite thing to me with someone in the medical field says that like, oh, you know, can't do that, it's dangerous. And it's like, it's so easy to pick apart. It's so easy to pick apart as soon as you ask them to be questions about it. Because most of the time, people who have that opinion have never been to a CrossFit class and don't know what it is. So that's the first thing. So I usually ask people that, I'm like, have you ever been to CrossFit? Do you know what it is? Well, no, but like, I know a guy who blah, blah, blah. Yeah, okay, cool. But there's that part of it. And then it's like, part of it as well is like looking at, well, if you're telling people not to CrossFit, what are you telling them to do? Like, are you telling them to sit at home and do nothing? You think that's better than doing X, Y, and Z? Like, think about that. But also, and then it's like, well, actually medically in the literature, that's false. Like that's a false statement based on numerous studies that have proven, that have shown that the injury rate is actually fairly low it's actually, up to 5 times lower than running, for example. People injure themselves running far more than people do CrossFitting, and that's a proven fact. And then the ideas of functional movement, high intensity movement, constantly varied movement are all sound concepts in the literature as well. So combining them also is a sound idea. And then I also like if patients tell me that, patients like they'll say like, oh, well, my doctor told me not to XYZ. I'll say, does that person who told you that look like someone you want to take fitness advice from? And if the answer is yes, if the answer is yes, then do what they're telling you to do. But I can almost guarantee you that it's not. Almost always, So like, and if someone's like, if someone's super anti CrossFit and they think it's terrible for you and whatever, and it's like, well, if you got something better and you're ripped from doing Zumba and that's what you want to tell people to do, then go for it. But I haven't seen it, so
that is absolutely where I was going with all of this, and I'm so intrigued by it because now that I'm really like into the CrossFit world, like even more than I thought I'd ever be, it's when I'm around medical professionals, it's almost shocking to me in most cases, like and I'm not trying to generalize because it's wildly inappropriate, but like I would say more often than not, I am finding medical professionals that have no fitness outlet or anything else. And I understand it's an incredibly demanding job, and I couldn't possibly understand the amount of stress that they feel and go through every day. But I guess how challenging is that to see your peer group, with you making sure that you're always doing the right things to be fit, to, lead by example. But then you see your peer group not necessarily doing that.
Well, part of it, it's funny because in the clinic, patients are genuinely surprised when they see me. Like if I don't have if I'm like not wearing sleeves that day, and they're like, cannot, they're like, you're the only physician I've ever seen that looks like that, which is crazy, right?
Literally though.
Wow.
It's crazy. And I work in sports, so I've said this before, like I get more respect from patients from that than I do wearing a white coat. They respect that more, I think, in general, especially as a woman. I think there's this kind of especially if I'm dealing with like a guy who's like an athlete, they'll be like, oh, like you must know what you're talking about. It's not the Harvard degree on the wall. It's okay, and which is valid point. But to me, it's more like it's somewhat frustrating. I could see how being in medicine, like you don't have a lot of time to take care of yourself. That's just not prioritized, and it's just you don't have the time for it in a lot of specialties. So I totally understand that. For me, it's a little bit of like, don't kind of like rain on my parade if you don't have an alternative that's better. That's kind of my thought about it. And especially like I work in orthopedic sports medicine and I deal with injuries, and it's like, yeah, you're going to see people who get injured doing CrossFit, and there are a lot of reasons for that, but part of it is because they're doing things with their bodies that other people don't even try. So
right,
it's like, it's a problem of fitness, right? Like as a medical field, if we had problems of fitness as the biggest problem, like that would be a really good problem to have. People who are injuring themselves exercising, if that was like our biggest issue as like a medical field, like consider ourselves lucky. So,
true.
Very
true.
So
it was fascinating to me because that's like, candidly, I'm not normally a person that finds myself in the doctors, but over the weekend, my fiance's brother ended up with a kidney stone, so he had to go to Maine Med, actually, of all places, and they sent him home with the packet, the medicine. They ended up having to do surgery, but in the packet there was no guidelines for like, hey, this is what kind of food may cause this, depending on the type of kidney stone. Again, I'm not a medical professional, I can't get into it, but of course my fiance immediately started doing research of coaxilates, or I probably didn't even pronounce that right, but like the only advice they gave him was, hey, go home and drink Gatorade. And I was just stunned by it because it's like where are we going with this? Like, we're not attacking like a root cause. And again, I'm not trying to like, attack the advice or anything like that. I'm genuinely curious of.
Yeah. Well, why that happens
is
that happens for two reasons. One is that as in medicine, like in medical school, and at least back when I did medical school, we're not taught about nutrition, and we're not taught about very little. And a lot of the guidelines that we're taught are, and this kind of goes back to kind of similar to with the CrossFit data, but a lot of the guidelines that we're told by, say, like the American Diabetes Association or the American Heart Association, those guidelines are in general influenced by things that are, there are industry influences on those guidelines, or there is old data that supports those guidelines. If you have a heart attack, someone says have a low fat diet, XYZ, but they'll tell you, and so there's a lot of just like old nutrition advice. That's kind of what we're taught, and we're taught about it for like 30 seconds. And, and if someone comes in with an issue, like, they have like these general printouts that print out these like kind of shitty nutrition advice, and that's what you get, right? So that's part of it, is that we're not really taught about it enough to educate people about it. And a lot of physicians don't know, because they don't think about that stuff. That's not, they're like, can I save your life? And can I fix your like acute pain issue? Okay, now that's it. That's my job, right? So that's part of it. And then the other part of it too is, so it's like the lack of knowledge, or people think they're giving good advice because that's what the AHA told them to say. So like, that must be true. And then part of it too is like, and I see this in as someone who's like an exerciser, who tries to eat well and all that stuff, most of the people that I see who have aches and pains and problems and arthritis and back issues, whatever, they want me to fix them, and they want to go home. They don't want to take a deep dive into their nutrition and say, well, maybe if I was 50 pounds lighter, my knees wouldn't hurt as much. They want me to inject something in their knee so they can go do whatever they want to do. Like, so like there's a lot of time involved in like nutrition counseling and all that. So even if you have all the tools and you really know what you're talking about, it's really hard to reach people, because most people in general, I'm making sweeping generalizations, but most people don't want to hear about it. Like they don't, or they'll go, I heard, I think I might've been Greg Glassman who said this, but he's like, when you ask somebody about what they eat, it's only an opportunity for them to lie to you, because I can tell what you eat by looking at you.
Yeah.
I don't need to hear what you eat, because I know. And you'd be surprised how many people come in my office who can barely fit in a chair who tell me, oh yeah, I eat well. I exercise every day. Okay. Like, and if that's where your head's at, like, I literally don't have the time to try to convince you otherwise, and not to mention like the whole kind of shitstorm you can cause by like, if someone thinks you called them fat, like they'll be online saying all kinds of bad things about me. You know what I mean? So, so it's like, people don't want to necessarily know the truth either. So, you kind of have to meet people where they are, and it's like, this is what you want to do. Okay.
Man, that actually does go to another side of the conversation, because I actually had this conversation with my physician maybe a year ago or so. And I just flat out asked him, I was like, how frustrating is it, getting the same patients coming in with the same chronic pains, the same chronic illness, and you want to give them the real advice, but they're just not wanting to take it because that's American culture. So how is that for you? I mean, like, how frustrating does that get? Is that debilitating?
Yeah, I mean, it's certainly, there's people with like weight issues who, kind of maybe aren't really ready to change things about what they do, and that happens. Sure. That's fine. So that's frustrating when the attitude is sort of like, people come to me, and if it can get frustrating when it's like, I'm doing what I can here, and it's only going to work so much in this situation, Sure. Or, even stuff for something like rehab, you send someone to PT and it's like, well, they don't go, or they went once and it didn't really help, blah, blah, blah. Well, did you do it? Not really. And it's like, so at the end of the day, like, I say this to my staff a lot, it's like someone's, complaining about whatever, and they didn't want to do this and they don't want to do that. And I always say, like, well, it's your knee. My knee doesn't hurt. Your knee hurts. So if you don't want to do all the things I'm telling you to do, and it's still your knee, you know, and like, it's like at a certain point, that's kind of the attitude you have to have, you know. It's like, I feel okay. So you can listen to what I'm saying, or you can do what you want to do. You know, so there's sort of a little bit, you just have to kind of like wave your hands at it and say, all right, well, it is what it is. But
wow, that's so
That's
interesting.
funny.
I mean, because
Yeah.
like it's things that I take for granted.
yeah,
There's a good parallel to for CrossFit coaching. I forget who was telling. I think it was the owner of the gym at the time. Is like, at a certain point, like this doesn't happen too often, but every once in a while, you're trying to tell a member like, hey, maybe take a little weight off the bar, or do this differently.
Mhm.
And sometimes they're like, no, I want to do it this way. And you're like, this is exactly what he told us word for word. He goes, all right, it's your fitness. And so it's kind of almost exactly what you said. It's your health. Like,
yeah,
I can tell you what to do, but I can't make you do. I'm sorry.
yeah, you know. So there's that part of it where you're just like, sorry, I'm gonna I can offer you what I can offer you, and then beyond that, it is what it is. So
That's fascinating to me. I mean, it's something I totally take for granted, because like I think of my world, and I think as CrossFitters, we don't always realize how small our world is until we venture outside of our world. And then you know, I think I was at the beach with Matt surfing the other day, maybe a couple of weeks ago, and you know, I kind of took a look around, and I was just like, wow, there's a lot of obesity in American culture.
Yeah, and it, you know, it's I think also part of that too is, and I hear this a lot from coaches, you know, who are like, well, you know, we're doing what the doctors won't do, you know, we're changing people's lives. And it's like, yeah, I agree. But at the same time, you have to understand, like, when someone walks into a gym, their attitude is very different when they walk into a doctor's office most of the time. So like, when someone's coming to a gym and that's already, they're like 10 steps ahead of where they are when they come to see me. You know, they're saying, they've already said to themselves, I want to do something. They've taken a step to do it. They found themselves in the right place, and they're willing to at least listen and try something. Like, that's like way ahead of where someone walks into a doctor's office most of the time and they have issues related to their weight or their, you know, chronic disease or something. Most of the time, they're not saying, what can I do to fix this myself? They're saying, like, what do you have for me? They're saying, fix it, you know? So yeah, the coaches are doing the work that we wish we could do, but most people don't come to us with that attitude that they can come to a coach with.
Man, that's a really fascinating way to look at it, because I you know, obviously I've never thought of it from that perspective. And yeah, it's really, so me as a salesperson, that's like actually getting somebody that's ready to buy, as opposed to making cold calls. So good grief, you're basically just having to deal with the cold call aspect of it.
Most of the time. But but the thing that like excites me is like when I get the one person who's like wants to do what I consider to be the right thing, and I'm like, oh, okay. So what I think like the best that we can hope for as like medical professionals is that when you meet that person, that you have the right tools for them, or you know the right people who have the right tools for them. And that's where like my kind of grand idea of like connecting the health system with the CrossFit system. Like, when I find somebody who wants to do it, I'm like, okay, great, let's do it. Like, I know this coach, this place who's going to help you, and boom, like, I can make it happen. But like the amount of times that happens is like 0.05%. So
sure. No, I can already see the flip of the switch, and your like passion coming out in that moment.
Right.
It's got to be amazing when that person does walk into your office.
Oh yeah. Or like if I get somebody who's like someone who wants to like do a PT, but like with someone and I have like a network of like CrossFit PTs that I trust and stuff. And I'm like, oh, I know the guy who's gonna work with you and gonna do exactly what you need. And like, boom, let's make it happen.
Oh my gosh.
You know,
I love that.
But that's like so rare. But when it happens, I'm like, okay, we got it. We can do this, you know? So that's exciting. You know, I've also gotten
as more and more publications come out, and you know, the world and the literature does start to change, we can only hope that, you know, instead of that one person, becomes 2 or 3 people at a time.
Yeah. And it's like it's a bit of a chain effect too. I mean, like I've had some people at my staff that works with me, like they always say, I can never CrossFit, you do that. And I'm like, no, let's do it. So like one day I was like, okay, we're all going to go to the gym. There's like a gym down the block from where I work. And I brought a bunch of them there, and they like like they all like fell in love with it, and now like I got like 4 people of like the 7 people that went to join, and it's like
That's so
to
cool.
me like that's like yay, they got it, you know, and like and they're excited about it, and they're amped, and they're like doing stuff, and it's like, and it's just sometimes it's just a matter of finding that like way in with the right people at the right time and making those connections, and it's like, well, if I can make those connections, then I'm happy to do that.
That's awesome. That really is.
Yeah, it's cool.
I was just meeting with a quick story, and then we'll start to wrap up. I was just meeting with a strength and conditioning coach today, who's at a local high school here, who's also a CrossFitter, CrossFit L1, and he's basically running these kids through CrossFit workouts. But he's like, he's been doing it for a while, so now everybody's on board. But he's like, in the beginning, he had to be really careful like what he was calling CrossFit, because he had everybody was like, wait, well, what are we doing with the kids? Like, but now like he's built a community where, like you said, it's a domino effect where he has the teachers and the staff like doing workouts with him at like 5 a.m. Like it's really it's really cool how it's spread and how it can spread. So there's a light at the end of the tunnel for this, I think.
Hopefully.
Yeah. Okay, so we'll start to wrap things up. Obviously, thank you so much for your time. I honestly probably have 100 more questions, but I'm not going to bore you guys. So we got 3 questions. The first one is, and it could have been something we already covered, which is totally fine. What's one thing that most people think is true? And again, this could be CrossFit, medical industry, just anything. That you believe most people are actually mistaken, or an easier way a less mouthful way to say this is a common misconception.
I mean, I guess to go with the theme is kind of what we've been talking about. You know, this idea. Well, I guess, I mean, it sort of piggyback on what you just asked me, but, you know, as far as like, I think doctors get a bad rap because of kind of this like, oh, they're just trying to do like the quick fix, whatever. And it's like, it's a little more there are people who are doing that, but there's also kind of the attitude that we're met with and kind of the time constraints that we have. And it's kind of like, we kind of have to just we have to kind of take care of the problem in the moment and then hope that, you know, we can connect people with other people who can kind of further break down some more complicated issues. But it's not necessarily the attitude that we want to have. It's like, I don't want to be injecting everyone with steroid all day, but like a lot of people, that's what they want from me. So that's kind of what I do sometimes, you know, but you know, one of you came into my office, it's like, if one of you came to my office and I'd be like, oh, wait a second. Okay. Like we're going to do this differently. So it's a matter of finding the practitioners who know how to do it differently when it's appropriate.
Sure.
I like that. You have to work with the tools you're given with, and each person's different that comes to you, and you have to know how to, you know, treat people differently based on like what they need, what their wants are, their readiness to change, all that. So kind of like what we were talking about. Anything you are excited about coming up in the future? Anything you want to plug? I know you've done a lot. I'll just list them real quick. You had the larger body athlete course at the Games Adaptive Training Athletes. You've done the Battle Cancer Program, Barbells for Boobs, Invictus Boston Invitational, but I listed them all out. I don't know if there's anything else. Or,
well, tomorrow I'm doing a competition out at Move Fast Lift Heavy.
Let's go.
We'll see how that goes. Whoops. So I'm doing that.
Good luck.
Thanks. We'll see what happens. Other than that, I mean, you know, I'm always, I guess, like my Instagram and Twitter at Amy West MD. I can keep you posted on the things that I'm doing. There's always podcasts floating around and talks I'm giving about this or that. I work with a lot of the different CrossFit nonprofits and kind of peripherally with CrossFit Health and what they're doing. So, you know, so there's always cool stuff happening in that space. So I post it there. I also work a lot with like women's sports issues and things like that. So
cool.
Awesome. Very cool. And then this is our final wrap-up question. So I stole this directly from Tim Ferriss. So I don't know what's the major highway near you in New York.
Like the LIE 495. Yeah.
All right, 495. Let's go. So
mhm.
you get a giant billboard on 495. When I talk about Rhode Island, I tell people to get the Rob Levine billboard. He's just a car accident lawyer, but his billboards are everywhere.
Okay.
So you get that
Mhm.
billboard for the day, and you can put your favorite quote, mantra, or saying on it. Basically, something you can like just show to your community in New York.
Mhm. Yeah. Well, it's something that was said to me once that I liked it so much that I tattooed it on my body, but it's something that I tend to think about myself. But the saying is, "I conquer quietly."
Okay, I like it.
And I think in general, it's like I just kind of do my thing, and in general, I just like try to do good work that's like effective and cool, and I don't talk too much about myself unless I'm on something like this where people ask me to, so I'm happy to do that. But so I just remember, people said, "You conquer quietly, don't you?" And I was like, "Yeah, I like that." Yeah, I think I do. So
no, we can totally see the humility, and you're fantastic.
Oh, thank you. Spread the word. I'm happy about that. Yeah, so.
Oh my gosh. No, you have been absolutely gracious, and we really appreciate your time. And just the fact you're willing to have an open conversation like this with us, it means a lot.
Totally.
No, thank you for having me. Happy to do it. I'm happy to do it.
Thank you so much.
Thank you.
Cool. Well, we'll stay on to Zoom just for a second, but Rhody Strength, we're signing off.